So, Laura, you are one of our best, most interesting bloggers, and you're a holistic health coach, and I understand that you're also a workplace wellness coach right now. So I think you're a great person to talk to about how you've used InsideTracker. You wrote this blog called I Ran a Marathon and I Got Fat. And I was like, I've got to talk to this girl. So you've used InsideTracker in that context. Tell us about it.
Yeah, so it's so funny. When I wrote that blog, I just want to say, I would never personally self-describe myself as a fat person, but
No.
But I definitely, I have a tendency to gain weight when things are not right in my body, and I can gain a lot of weight. I gained 20 pounds over the course of maybe 4 or 5 months, all while eating kale and training for a marathon. And it almost seems unfair, and what that led me down that road of just seeking answers, because I think when something like that happens to you, you feel crazy and no one believes you. People
Totally.
are always like, well, you just, you're overeating, you're lying to yourself about how many calories you're eating, you don't want to take responsibility for yourself. I mean, people say all these crazy things, and I think even our doctors say crazy things to us because they don't necessarily have an explanation right away. And I actually had a lot of different symptoms that were going on. I took to my doctor, and she was so funny. She was like, I'm really hoping this is your thyroid because it would explain everything. And, and she ran all the basic blood work. And then when she gave me my blood work back, she was like, oh, you're normal. And I was like, oh my God, I don't feel normal.
Right.
I feel crazy. Like, I feel the opposite of normal, and I needed more answers than that, because even though, so in the article I talk about all the different reasons that you might gain weight while running a marathon, and I really, the only one that seemed to fit my bill at the time was that there had to be biomarkers off inside my body. I must have been overtraining, or and actually, as it turns out, I was physically it was the perfect storm of problems to cause me to gain weight, and certainly overtraining played a huge role in that, as I later discovered. So I decided, because my doctor had run this blood work, that I needed to run better blood work, and I knew about InsideTracker because I had gone to an executive athletes. I went to an executive athletes social networking event, and the InsideTracker was presenting there that day. And of course, as a health coach, I'm looking at this and going, "Oh my God! Like real data!
It's your dream come true.
Dream come true! I want all of the data." And so I immediately signed up as soon as I left the doctor's office, and she was like, "You're fine," and I was like, "I need to go get real answers."
Yeah.
And so. So that's what led me to InsideTracker, and immediately, so the thing that I think has been the most useful, that has helped me advocate for my own health the most from InsideTracker, is how you see the optimal zone, and that optimal zone is different from the normal zone, which is different from the out of normal range. Yeah. And I think that's such an important key thing that you very rarely ever get at your primary care physician's office is. It's like they're comparing you to what's normal for all humans, including children, including 90-year-old people of both genders. And it's just, it was such a relief to see where I was out of the normal ranges for a 35-year-old athletic female.
Yeah. And I think, part of the reason I love your story so much is because it's not too dissimilar from mine, but also it's not too dissimilar from a lot of young women, or actually women of all ages. How often does a female friend or family member of you say, my doctor says I'm normal, but I'm not normal. I feel terrible. I look terrible. I'm not sleeping. I'm stressed. I'm gaining weight. I don't know why. I promise I'm doing everything anyone has ever told me. And yes. It's such a common theme. And as women, obviously our systems are delicate. Hormonally is a much more delicate balance, right? Yeah. And so the fact that it's not taken into consideration half the time, to me, is just insane. So reading your story was like, that's why I was so attracted to InsideTracker, is because someone finally told me you can be optimal and not, I don't want to be normal. Who wants to be normal? Not me. I want to be great.
I want to feel great. I want to feel strong. I want to feel like my legs are not like, I don't want to feel like I'm dragging a 2 bricks along with
I'm sure.
trying to run a tempo run. Like,
I'm sure it didn't look as bad as you thought, but believe me when I tell you that I've gone through the same thing, and so I really empathize with you. So then the takeaway is you had one InsideTracker test, you got your data. Then the best part is that you had another one, and you actually ended up writing another piece about what you had learned from all of that. So tell us what stuck out to you, what really helped.
Yeah. So, and I actually had like an even bigger follow-up from all of this. So I've actually used InsideTracker 3 times. So the first time I used the DIY, where I took all the data from my doctor and I put it into the InsideTracker system, and where my doctor had said, oh, you're fine, with the same numbers, the same data from that same blood test, just plugging it into the DIY like module there, I immediately could see that, no, that was not at all true.
That's awesome. Amazing.
Things that were out of line. And so I immediately got to work on the nutrition recommendations based on the DIY. And then about a month later, I had my, like just 1 month of making changes. I saw a bunch of numbers improve. My, I can't even remember right now what they are because it's been such a long time. I know that my hormones improved immediately, and I was watching some really interesting things happen with my vitamin D, which I had been supplementing, and then could clearly see I did not like supplement. It was way too much.
Right.
So I had stopped taking the supplement, and I was watching my vitamin D come back down, which is a continuation of the story continues there.
Okay.
But I was seeing that come back down. I stopped taking my vitamin B12 because I could clearly see over 2 tests that I didn't need it. And that has continued to remain through all of the tests that I've had since then, which I was like, I feel bad, and people who feel bad should take B12.
Right.
And then through looking at my blood work, I was able to go, no, actually, that's not contributing at all to why I'm feeling bad. And so that was really eye-opening. I've watched my white blood cell count improve.
Okay.
I have been able to track my blood sugar, which, again, contributes to the furthering of this tail. So I've watched like my glucose change, and definitely was able to like be reminded of all of these other foods that you get away from as you're panicking about weight gain, and you're like, oh my God, I need to cut out all the carbs, and then you realize, nope, that's actually not true. As soon as I put these whole grains back in my diet, as soon as I put the brown rice and the amaranth and the quinoa and all of that back into my diet, all the other biomarkers improved. So, the C-reactive protein improved. I said the white blood cell count improved. I'm getting better with my iron. Still not perfect.
A lot of women struggle with that. I do too.
It's hard. It's so hard. Especially I'm one of those women who has like a really intense menstrual cycle, so I just feel like I'm fighting a losing battle.
Right.
But, so that was the end of the first test.
Okay. And then you said we want to hear the end of the tale, Laura. Come on.
Okay. So one of the things this is really interesting, and it's another thing that I really like about InsideTracker is that I'm a person who I think my story is fairly typical of people today in their 30s who have had lots of different jobs, whereas like once upon a time people had a career and they stayed in that job and that was that, and you got your insurance through your employer and you had the same doctor for 40 years. I've bounced around so many times. I've had so many different doctors that my all of my blood work, I have no idea where it is.
Yeah, me too. Same thing.
Out in the ether somewhere is all the tests I've had since I, was a kid. And so now, for the first time in 15 years, I've had, it doesn't matter who runs my blood work, which doctor I'm at, everything goes into one place, and it's all showing me, like, this story over time. So if what I was able to identify, and it pinged on 3 InsideTracker results, was that my calcium was too high. And by the 3rd, and not just out of normal too high, like out of health, like
in the red.
red zone high. And my vitamin D, by the 3rd InsideTracker test, which was 6 months after the second one, my vitamin D had plummeted down below normal. So it wasn't this was the first time that anyone had ever told me, hey, you need to go see a doctor about that. Like, you need to bring this to your doctor's attention. My doctor, who ran the first blood test that showed the high calcium, didn't even bring it to my attention.
Wow.
And it took me having 2 more tests through InsideTracker, taking a look at how those numbers were just going higher.
And of course, there's a relationship between vitamin D and calcium, which it explains to you.
Important relationship between vitamin D and calcium, which I knew as a nutrition counselor that there was a relationship between D and calcium, but I didn't understand calcium enough to understand why it would be so high out of normal when my vitamin D was going lower and lower and lower. And so I immediately called my doctor and got a reference to the endocrinologist based on my InsideTracker results. And now I have, that was back in August. And so now it's November. It'll be November. Today's...
You're due for another test.
Yep. I'm due for another test, but actually we're holding off on that because I've had so many blood tests since then, because as it turns out, what this was that was causing it is something called primary hyperparathyroidism. And that is a tumor, a benign tumor that's been growing slowly on one, maybe 2 of my parathyroid glands, that's been leaching the calcium out of my bones and into the rest of my body and lowering my vitamin D, because my body's trying to protect itself from this hypercalcemia. And so these 2 little tumors need to go.
And so all of that from tracking your blood, huh?
All from tracking my blood. This could have gone on for years before a doctor might have found it and pinged it, because I'm really, really young for this condition. Even though my calcium is high and above normal people high, it's not high enough. Like, what they keep saying to me is, well, it's not that high. Your calcium is high, but it's not that high. But when you compare that to what's right for a 35-year-old, it's actually really high. And so it led me to advocate for myself, to say, no, I mean, I understand what you're telling me, and I can see on this chart what you're telling me, but I'm telling you, this explains everything. And it gave me the courage to not second-guess myself, to self-advocate, and so now I'm meeting with a surgeon at the end of this month. So,
well, that is an amazing story with a very happy ending, it seems, despite the fact that surgery is never good, and I never want to hear that anyone has a tumor of any sort, but I'm glad that it's benign, and that you're going to be able to take care of it, so that, next blood test you get, everything hopefully will be trending towards normal.
And it was so interesting, because when they're talking to you, and I understand that doctors need to be cautious and they need to check all the boxes, but they're like, they keep saying, they're like, well, it's not that high. And I understand that some people with this condition get calcium even higher, and they like literally go crazy, and they have kidney stones and all these things. I've experienced some symptoms, but nothing wild like that. Like some heart palpitations and weak bones, and early onset osteoporosis, and it's a big deal.
Of course, it's a huge deal. You need to catch it early, something like that. Can you imagine if you never knew and you waited until you were 45 and it was a massive problem? There's a cascade reaction for everything.
Right, and so now the other thing so I'm really excited for after surgery. I'm going to have my InsideTracker results done again.
Okay.
A new blood test. Ooh, I'm so sorry. And I'm going to have a new blood test done. And my phone.
You're very popular.
I'm so popular. Everything is all connected. Anyway, I'm going to have my InsideTracker results done again, and I am so pumped to see if having my calcium levels for the first time probably in 10 years in the right zone will finally have an effect on some of the other biomarkers that I just couldn't figure out why they were abnormal. And now I'm like, I know why they're abnormal, because they're related to calcium, because so many things are related to calcium. And if I can get that in the optimal zone, maybe everything else will be optimal. And I'm so excited. So that's why I'm waiting for after surgery, and then...
Well, we'll have to send you a giant green InsideTracker get well soon balloon. So let us know when it is, and more importantly, I wish you all the best, and good luck with the surgery. Be safe, and we'll have to catch up on video when you're all recovered, because I want to hear the happy ending that I know is coming for this story. Yes. Thank you so much.
Yeah, you're welcome.
Yay.